Here is a clinical dilemma that is familiar to all of us who care for patients who need anticoagulation. What to do about someone who has a warfarin-associated GI tract bleed, but also has an ongoing risk for thromboembolism. The question is whether and when to resume anticoagulation. Now in the Archives of Internal Medicine, researchers give us some help with this problem. They studied patients who had a warfarin-associated GI bleed and determined the incidence of thrombosis, recurrent bleeding, and death, as well as the time to resumption of anticoagulant therapy during the 90 days following a GI bleed event. There were 442 patients with warfarin-associated index GI bleeding included in the analyses. Following a GI bleed, 290 patients, or 59%, resumed warfarin therapy. What they found was that warfarin resumption after the index GI bleed was associated with a lower adjusted risk for thrombosis. No surprise here. But also a lower incidence of death without significantly increasing the risk for recurrent GI bleeding. The take-home message from this study seems clear. The decision to not resume warfarin therapy in the 90 days following a GI bleed is associated with increased risk for thrombosis and death. For many patients who have experienced warfarin-associated GI bleeding, the benefits of resuming anticoagulant therapy will outweigh the risks. I'm Peter Block, and this is a CardioSource Heart Minute.